डॉक्टर नवदीप शर्मा को दुनिया भर में आयुर्वेद का जागरूकता फैलाने के लिए सम्मानित किया गया। लंदन में इंडो यूके लीडरशिप समिट में द वर्ल्ड बुक ऑफ रिकॉर्ड्स ने दिया उत्कृष्ट पुरस्कार।
लंदन में इंडो यूके लीडरशिप समिट का आयोजन, आयुर्वेद को लेकर जागरूकता पर जोर, द वर्ल्ड बुक ऑफ रिकॉर्ड्स ने लोगों को किया सम्मानित।
ब्रिटेन में बसा भारत का डंका, नवदीप शर्मा और डॉक्टर मोनिका शर्मा को मिला आउटस्टैंडिंग कंट्रीब्यूशन टू आयुर्वेदिक हेल्थ सर्विस पुरस्कार।
आयुर्वेदिक डॉक्टर नवदीप शर्मा को युवा प्राणाचार्य की उपाधि दी गई। भारतीय आयुर्वेद महासम्मेलन में सम्मानित किया गया। कार्यक्रम में मनोज तिवारी मौजूद रहे।
नवदीप शर्मा को विश्व के सबसे युवा प्राणाचार्य की उपाधि मिली। अखिल भारतीय आयुर्वेद महासम्मेलन में मनोज तिवारी भी शामिल हुए।
Up next, most trusted Ayurveda-based healthcare brand of the year, and it goes to ND Care Nirogam Private Limited. Dr. Navdeep Sharma, Director, to please join us on stage.
देखिए, अटल बिहारी वाजपेयी जी हमारे लिए बड़े ऑनर्ड हमारे प्राइम मिनिस्टर रहे हैं, बहुत बड़े लीडर रहे हैं और उनका अवार्ड, उनके सम्मान में किए गए समारोह में अवार्ड मिलना अपने आप में बहुत मायने रखता है।
When I was younger, I was very sensitive. I could feel the pain that people endured. My father once told me, it's good that I can feel people's pain. It would be even better if I could transform one's pain into soothing relief. These words of my father nourished and nurtured the divinely planted seed in me to become a compassionate healer. And my journey with Ayurveda, the science of life, began. According to Ayurveda, our Panchabhautik body is an amalgam of space, air, fire, water and earth. And solution to all chronic ailments lies in balancing these body elements. As the origin of Ayurveda goes back to thousands of years, so some part of our ancient historical knowledge is lost. That's why I started my own research and shared it with the world. Ayurveda can give very quick recovery, even quicker than allopathy in most chronic ailments.
The blend of Ayurvedic medicines, Panchkarma, yoga, diet has helped Dr. Navdeep Sharma create the brand Wrist Pushed and Team Nirogam by treating thousands of patients suffering from chronic illness. Join Dr. Navdeep Sharma's guided path of healthy living. Call now at +1 888 624 5925.
आइए अब आपको दिखाते हैं कोरोना संदेश।
सभी व्यूअर्स को मैं डॉक्टर नवदीप शर्मा नमस्कार करता हूं। पिछले 21 वर्षों से दुनिया भर में आयुर्वेद के माध्यम से मैं इलाज कर रहा हूं और आज मैं देख पा रहा हूं कि पूरा विश्व आयुर्वेद की ओर इम्यूनिटी बढ़ाने के लिए एक उम्मीद से देख रहा है। सदियों से ही हमारे यहाँ राजा महाराजा चांदी के बर्तनों में भोजन का सेवन करते थे अपनी इम्यूनिटी को बढ़ाने के लिए। तो आप सबके घरों में चांदी की पायल, बैंगल, पेंडेंट, कोई भी आभूषण हो, जिस पात्र में आप पानी स्टोर करते हैं उसमें वो डाल दीजिए। उस पानी का सेवन करने से आपकी इम्यूनिटी जो है वो बेटर रहेगी। शुंठी, मरीच, पिपली, ये 3 हाथ जो किचन की शोभा बढ़ाती हैं, इनका इस्तेमाल अधिक कीजिए और भस्त्रिका क्रिया अधिक से अधिक कीजिए। इन चीजों का इस्तेमाल करने से आप रिष्ट पुष्ट रह सकेंगे और कोरोना नामक महामारी को दूर भगा सकेंगे।
A very good day to all of you in this evening live interactive session of ours for our Indian viewers and a morning live session for the US, the Canada and for all of you around the globe. As per your time zones, we welcome you all in this live interactive session of ours, and as always, one of our reasons for joining you on this live session is discussing quality Ayurveda with you. And a very important reason is taking your questions. Whenever you feel that there is some health concern which you are facing, which you want to discuss, with the help of Ayurveda, we always prioritize your questions and those questions are also taken. So, moving ahead, when we talk about Ayurveda, now Ayurveda is in itself a lifestyle. Ayurveda doesn't just mean the using of certain herbs to get rid of your problems, but then in itself it's a lifestyle. If we talk about today's era, today's world is full up of so many diseases which are attributed to the modern day sedentary lifestyle, a lavish lifestyle which at some stage used to be that of the kings, the queens and those who were very blessed, but nowadays it has become everyone's lifestyle. The physical work has drastically come down. As a result of that, so many lifestyle disorders like hypothyroidism, like diabetes, high cholesterol, high blood pressure, obesity, there are so many diseases which are creeping in today's life, and once they creep in, we are having no other choice but to take so many of allopathic painkillers or hormonal supplements or other supplements. So there are so many in fact of diseases which are troubling us all. So that's why following Ayurveda from the very core is so important. So I always request all our viewers, when you believe in Ayurveda, do not just believe in Ayurvedic treatments. Always believe in Ayurvedic lifestyle. That is something which is really so very important for everyone to follow. And when we talk about Ayurvedic lifestyle, now what exactly is Ayurvedic lifestyle about? Early to bed and early to rise. Ayurveda believes that our meal time which we take, specifically the evening meals which we take, should not be later than late in the evening. It can be from 6:30 in the evening to somewhere around 8. It should not be later than that, because if we are going and we are delaying the meals later than that, we are then burdening up our body system to be producing those digestive hormones at the wrong kind of time. We are expecting them to be producing those hormones at the wrong kind of time, and as a result of that, there are so many diseases which are waiting for us. The same thing about waking up early in the morning. Nowadays, all thanks to the nice air conditioning that we get around the globe, which gives us a comfortable temperature throughout the night, making our night even more comfortable. But as a result of that, nowadays, the waking up time of majority of today's generation is not early in the morning. As a result of that, the early morning requirements of the body are not met with. Since we are not taking care of getting up early in the morning, as a result of that, the biggest problem which everyone nowadays is feeling, constipation, then morning stiffness, malaise, again the sedentary lifestyle diseases which I just talked about. So if you are a firm believer of Ayurveda, right from today itself, start working on your lifestyle. Start taking the meals by an early time. Many of you must be taking your night meals by 10:30, 11, and I come across many patients who are even taking at 11:30, 12. So let us start at today itself. Let's start preponing our dinner. It should be in the late evening, making it easier for our body to digest that food, to bring out nutrition from that food. Because if that is not happening, we are then waiting for arthritis to occur to us. What exactly is arthritis? When we talk about rheumatoid arthritis, now that is the kind of arthritis which is troubling today's generation a lot. Person is told that you are eye factor positive. In majority of the people today, even if they are not eye factor positive, once a person crosses the 50s, knee pain is a very common thing. Every other person is suffering from knee pain, and then they are advised towards the removing and transplanting of their joints. That has become again a common thing. All these things can be avoided by following Ayurveda to some extent. So there are a lot of things to be discussed over here, but not before we have taken some of your questions, because as I said, your questions are always our priority. So Anusha Sharma ji, you have said that my doctor's articulation is not clear. How to work on it? Please suggest self-love sometime, how to make her independent on academy as well as the daily activities which are to be done. So Divya is your coordinator, you are from Sikkim, and I've been told that you have been taking treatment from us now since March. Shiropichu is going on, and there is improvements in understanding and in hyperactivity, but yes, we need to work on the articulation. The best way, the best herb which works on articulation is Vacha. And recently we prepared a very nice batch of Vachadi Grit. It's a special kind of a ghee. You can connect with your coordinator for Vachadi Grit and start using Vachadi Grit instead of pumpkin oil for the Shiropichu of your child. along with that Vachadi grit can also be consumed by her. That really helps in the articulation purposes. Along with that, there are some enjoyable activities like blowing of balloons. If you ask your child to do that in a playway method, that again gives a strength to the facial muscles, to the tongue muscles, and that really increases articulation. Singing is another method. If we involve her in singing, again the articulation in her case is going to improve. So you can try one or all of these things, and I am hopeful that you will see a benefit in articulation. Rest, whenever you get time, whenever you plan a visit over here at our center for an in-hour treatment, we definitely will be taking care that she improves on the part of articulation also. राजीव जी आपने बताया है कि 1 साल से ट्रीटमेंट चल रहा है, पेशेंट कोड आपने बताया है। राजीव जी प्लीज मैं आपसे जानना चाहूंगा कि कितने सेशंस और किसके अंदर सेशंस और क्या क्या उन सेशंस में आपको सिखाया गया। अगर आप हमारे साथ बने हुए हैं तो कृपया कौन से साइकोथेरेपिस्ट के अंदर सेशंस चल रहे हैं और टोटल कितने सेशंस ऐसे हैं जो हम करवा चुके हैं। इसके साथ साथ क्योंकि आपके कोऑर्डिनेटर जो हैं वो हमारे साथ मौजूद नहीं है, तो आपके कोऑर्डिनेटर को हम साथ में चेंज करने जा रहे हैं आपके लिए। अब से आपके साथ सुखराज जी कोऑर्डिनेट किया करेंगे। टीम आप प्लीज नोट करें, इसके आगे से राजीव जी के साथ सुखराज जी को कोऑर्डिनेट करवाएं ताकि राजीव जी को कंप्लीट डिटेल्स हमें क्या करना है, किस तरह से साइकोथेरेपी लेनी है, क्या क्या सीखना है, ये समय पे बताया जा सके और उसे फॉलो कर पाए। देखिए ये रिक्वेस्ट राजीव जी मैं हर पेरेंट से हमेशा करता हूं। बहुत बार द ट्रीटमेंट विच आई एम गिविंग, द ट्रीटमेंट इज मेनी अ टाइम्स कंफ्यूज्ड with normal Ayurvedic treatment. Let me tell you in detail. See, when I talk about my treatments, it's 60 to 70% of psychotherapy and 30 to 40% of Ayurveda, specifically in case of psychological disorders. So, it becomes very important that when we are taking treatment for a disease, so along with the taking of that treatment, we are also taking care of ensuring that proper psychotherapy is being done, because any herb that is being used in case of your child is also associated with the simultaneous technique in psychotherapy to be applied. Because what happens is whenever we are doing any kind of herbal intervention for the child, now generally those herbs will work on the subconscious mind, and the child will now be at a better stage to modify his or her behavior by and through a AB expert. However, if we are using the herbs but we are not doing the psychotherapy regularly, now that is what causes problem, because then it's only half the things done, rather less than half, because the major chunk of the work which was to be done through psychotherapy is now left unachieved. So I would like to have the details of exactly the psychotherapy which is being done, and as I just mentioned, we will be changing your coordinator to Mr. Sukhraj, who will be giving you even a better detail. John Vigji, I haven't received your patient code, however, and you have mentioned that you are from Austria. You need treatment for 4 years ADHD, and you are seeking guidance for that. Hyperactivity is there, picky eater, disturbed sleep. He always wants an iPad. So, Mr. John, I would request you over here that please share some videos of your child on the number which you are having on your screen. You can send it through WhatsApp, you can email it to us, but that will give us a better insight in your child's case, because we then will be able to exactly observe the problems which are currently being brought into our knowledge from your end. Now, when we talk about ADHD, ADHD is otherwise a disease which comes under autism spectrum disorder itself. A very marked difference between an ADHD child and autistic child is that the ADHD child generally isn't having very good relationship with peers. If the child is trying to play with the other children of his age group, he will either push those children, he may not indulge nicely with those children. So generally, the relation of an ADHD child with the peers is not very good. When we talk about giving a treatment to any child suffering from ADHD, we start working on the subconscious mind. When we work on the subconscious mind, the marked hyperactivity, which is a common trait for any ADHD child, that comes down. And when that comes down, the child starts concentrating, the child becomes more receptive, the aggression comes down, the concentration, the focus of child goes up. Now that gives immense benefit to the child. The best part is that for a child suffering from ADHD, the treatment is far quicker and far easier than a child with autism. The child with autism also comes out of autism, but ADHD, it is more easier because generally in a child suffering from ADHD, there is no major cognition impairment in the child. The rest we will be waiting for some videos on this number from your end of your child, which we can then analyze, and then we will be in a far better position to guide you. ज़किया जी, आपने बताया सर मेरा बेटा 4 साल का कमांड जो है वो फॉलो नहीं कर रहा है, मुक्तापिष्टी एंड बेनोआर जो है वो चल रहे हैं। मेरी रिक्वेस्ट आपसे रहेगी कि प्लीज हर हाल में आप ज़किया जी अपने बेटे के केस में शिरो पिचू जरूर करवाएं, वो बहुत लाभकारी है। एंड ABA मिस मत करें। जैसा कि आपने बताया कि जब एक्साइटेड हो जाता है तो टेक्टाइल हो जाता है, सेल्फ लाफ करने लग जाता है। आपके केस में भी मैं जरूर चाहूंगा कि थोड़ा सा पता चल सके कि किसके अंडर हमारे यहाँ पे ABA चल रहा है। देखिए क्यों ABA को इतनी तवज्जो दी जाती है। Many a times it becomes very important for a patient to understand this thing, and at the same time it becomes tough also. It is understandable that in today's world the toughest thing for anyone to spare out is the time. That is why when the parents they come to us for treatments, many of the parents they tell us that, see, we can take your medicines, we can do what you want to do as far as giving of medicines is concerned, but if you want our time, that is not possible for us. Now that's something where we always want the parents to understand that one of us has to do the ABA for the child. You can either learn it from us, do that for your child by your own self, that is the best thing to be done, but there are so many parents around the globe for whom that is not possible. So over there is no reason to be disheartened because we are there to do that for your child. But for that to be done, you need to be there with us. Your child needs to be there with us. Or anyone from your family can be there with us with your child. But one of us has to do that, either us or you. If we do not do that, if we do not spare out the time, still with the help of herbs that we are using, best part is still the hyperactivity will come down, the concentration span will improve, the cognition will improve. That means that without the slightest of things being done from your end, still our herbs are going to work. But we do not want our herbs to work partially. If you are there with us, if we have shown belief on us, it becomes very important for us to ensure that your child comes out of this autistic phase in a complete way. Because there is no benefit in partially improving your child even after coming to us. Partial improvements for your child can be had in your own countries, can be had from the common therapies which you guys are doing. So if you are there with us, what is important is a complete recovery, not a partial recovery. For that to happen, either give us your time, we will train everything to you, or bring the child to us. Let's do it over here. If we do it over here, yes. The last question of Mr. Satyam Rawat. Hello sir, is autism curable? Rawatji, autism is completely curable provided the parents believe that it is curable. Many a times what happens is, I'll be coming to all your questions just because I was taking a question and Satyamji's question connected in between that question. I took his lines because it is very much understandable when the world says it cannot be done. It becomes tough to believe that it can be done. And that is the biggest hindrance which comes in the recovery of autistic kids. The psychotherapy centers where you are going, many of them, your common family doctors, many neurologists, many psychiatrists will tell you, no, it cannot happen. Now, you are not bonded to us, we are new to you. At times it becomes tough for a parent to believe that it can be done. Especially in today's commercialized era, it becomes even more difficult. Many a times we feel that it's Ayurveda. Maybe something which is told to us is not correct. So I would like to tell you over here that see, it's not simple Ayurveda. It is 30 to 40% of Ayurveda and still 60 to 70% of psychotherapy. The psychotherapy protocols which I have developed in more than these 2 decades are different. They're different from the normal psychotherapy. They are deviations. I won't say the psychotherapist, what they are doing is incorrect, but it's more of a command-based thing which is being done in most of the centers. And commands being given to your child are never going to bring your child to a stage where the child becomes perfectly alright, where the child comes out of autism. If we want a child to be out of autism, our thought pattern, our planning has to be better. It has to be different. It has to be quicker. We cannot keep on waiting. It's not at every age that a child can come out of autism. Only in those lucky children who come to us at the right age, then the parents are either willing to give and invest their time on their kids or are willing to bring those kids to us. It has to be one of the things. Either give us your time at your own places or bring your kids to us. In both those cases, yes, the answer to your question is a child can completely come out of autism. And there are so many case studies for us to show you. I won't say testimonies, I would say case studies. When we say case studies, they really mean that yes, each and every step, what we did, why we make case studies is because we want the world to learn. We want the world to believe that yes, see, if we can do it in this way, you can also do it in this way. We do not want a single kid who remains autistic when God has given the capability to every child that the child can grow into a normal child, while let any child remain autistic. So, moving ahead with the question. Mahinderji, your question is, आयांश शर्मा दिसंबर से आज तक 9 मंथ से ट्रीटमेंट चल रहा है मगर हाइपर एक्टिविटी समझ नहीं है. So, Mahinderji, in this case, what is very important again is I always ask anyone who joins us, please do mention the name of your psychologist who is giving you the psychology sessions. And along with that, I really request you that please mention the number of sessions taken by you. Then I can comment on that. Then I can comment whether we need a change in the psychotherapeutic front or we need a change on the herbal front, or if everything is good enough and we do not need to change anything. So please share those details so that I can then guide you in a far better way on what needs to be done over here. Vidushi ji, you haven't shared your patient code and you said, good evening sir, tuberculosis treatment possible in Ayurveda allopathic treatment took. Now no fever, no weakness, only cough and pain or fever. I request you please guide me medicine and therapy. Vidushi ji, along with any of the medications that you are taking in allopathy currently, if your LFT is perfectly alright, because generally the allopathic medications for tuberculosis, they are having some hepatotoxic effects. If your LFT is normal, you can take Swarnavasanta Maltiras, one in the morning and one in the evening. That will give you a lot of strength and will give you a lot of immunity to fight with any kind of infection in your body. So please use one of these things. Either Swarnavasanta Maltiras, one in the morning and evening, and in case you feel that the LFT is not perfectly alright, then in that case you can use Gilay Sattva. Then Gilay Sattva can be taken. So one of these things you can take, that will really give you a lot of benefit. Moving ahead, Arina ji, you have written that you are there with Mr. Rajat for all your, you can say, queries and everything. He's your coordinator. And you have asked about what will be the treatment for sensory issues, ADHD, sleep issues, speech delay. Age is 15 years. And he was diagnosed at 2 years. And you are from Edmonton. So, Edmonton is a place which is very close to my heart. My sister lives in Edmonton. And that's why whenever I come to Canada, I always try having a meet with my patients over there in Edmonton. It gives me double benefit. I meet my sister also. Otherwise, we are majorly and primarily in Abbotsford in near Vancouver, but Edmonton is always a stopover for me. So when I talk about a child of 15 years with ADHD, I would like to have some further details. You have mentioned over here speech delay. What is the level of speech delay? Is she using words? Is she using sentences in a partial way, or is she completely non-verbal? Because if she is using some words, if she is using some sentences, that makes it easier for us. If she is completely non-verbal, then we can work on all major aspects for her. We can make her concentrate better. We can solve her sleep issues. We can make her cognitively better. But if speech is nil, then at the age of 15 years, we can only bring her to single words. But if she already has those single words, then we can change from those words to those sentences. Because what happens is, development of speech is possible easily up to a certain age. Once that age goes away, then all other things can be managed in autistic child. Speech becomes the toughest of all. That is something which really becomes tough. So I would like to have some further details from your end. Then we have Tahira ji. Tahira ji, you have mentioned your details, but it's a very long question, and I will have to get back to your coordinator to be guiding you in that regards, because I haven't had details from your end in regards of the coordinator details and the detail of your psychotherapist. If you can help me out with that, that will become more easier for me. So please share all the things in details with me. And before I move to the next question, do remember, Inaji, that your daughter is already 15 years in age. So we are already at an age in her case where we need to be very quick. So please do remember, whether it is with us or someone else, it needs to be quicker. So do remember, Seema, it's for you. The code is there with you. Do remember, in case of Tahira ji, ask the coordinator to discuss everything with me so that the patient can be guided in a proper way in this regards. Mahak Verma ji, you haven't shared your patient code, but you have mentioned that your nephew has got good improvements and you want to start your mother's treatment for diabetic and heart problem. Allopathy is going on. You are always welcome to try Ayurveda for your mom. You can post all the details with us and my team will be loving to guide you in that regards. And see, the most important thing is it's not just important to start an Ayurvedic treatment. It is more important, even more important, to adopt an Ayurvedic lifestyle, which is a healthier lifestyle for us. Saptan Rawat ji, you have shared that my daughter 5-year-old shows lots of improvement in doing tasks, understanding but her speech not coming, and she is having disturbed sleep and hyperactivity. What to do, sir? Please guide us. We are frustrated. Satyam ji, do not worry. If she is showing improvement in understanding, hyperactivity is not far away. Do share your patient code. If you do not want to share it on the public platform, the number is there on the screen. You can always share it over there. And don't worry, I would like to have the details of what exactly is being given to your daughter so that we can guide in even a better way. And please do not miss out on ensuring that ABA is regularly going on in her case. Then we are having the next question. Psychologist is Rashmi. 3 sessions have been done. Joseph ji, you are there with us, and it was on August 8, 2024 that you started with some of the treatment. It is Brainwire capsules and Mukta Pishti that was started for you. You are from US and you are there with us. And I would like to have the question from your end. If there is anything with which I can help you out, you are welcome to ask that. Christinia ji, you have shared your patient code now, and Zara is interacting more these days and we are getting nice feedback from her school. She is not a hyper child anymore. We are happy being parents. Shira Pitcher is helping you out and you are coming to India soon. You are welcome to be over here, and we will definitely try that we can give it at level best when you guys are over here so that you can get the best of recovery. And for today, that is all that we are having here with you guys for this live session. As I always tell you, we have lives on Wednesdays, a morning live which is for the national patients and the patients of the Indian subcontinent, and then this international live which we generally have in the evening, and when we try to take the question of our international viewers. Believe on Ayurveda, believe on us. We won't let you down. God won't let you down. Have a very good health. Stay wrist pushed. Namaskar.
Autism is a temporary phase in the life of a child if treated timely.
Patient name, Parth, age 3 years, disease, autism. Chief complaints, speech delay, hyperactivity, irritative behavior, less interaction, less understanding. The parents of the child consulted Dr. Navdeep Sharma on April 2023 at 1:09 p.m. and felt the scope of treatment to work for the child. He did not respond clearly and showed irritative behavior most of the times.
करो
आ जाएगा वो।
कलर करो, वेरी गुड पार्थ, कलर करो। नो इस हैंड से कर, वेरी गुड, इसके अंदर रख दो, वेरी गुड। पापा का हैंड, दीदी का हैंड पकड़ो, हैंड चलो, वेरी गुड, खाओ, वेरी गुड। हेलो पेरेंट्स, पार्थ हेलो करो, हेलो करो। ये पार्थ है मेरा बेटा, 4 साल का होने वाला है। लास्ट ईयर जुलाई में हम डॉक्टर नवदीप शर्मा सर के यहाँ पहुँचे थे। हमें एक सर ने मेरे बताया था सर के बारे में। हमने सोचा भी नहीं था कि आज 9 महीने में पार्थ मम्मा पापा हमसे बोलेगा इतनी जल्दी। हम तो मतलब बड़ा एक माँ पेरेंट्स के लिए रहता है कि कब हम मम्मा पापा सुनेंगे पार्थ के मुंह से। आज पार्थ मम्मा पापा और विद सेंस सब कुछ बोलता है। भगवान की कृपा से और सर की मेडिसिन और सर के गाइडेंस से आज 9 महीने में पार्थ एक नियर टू नॉर्मल लाइफ जी रहा है। और स्कूल में भी पार्थ प्ले ग्रुप में था। अभी जस्ट 15 दिन पहले ही स्कूल में मैम ने बोला कि पार्थ को हम नर्सरी में भेजेंगे। और जो सर ने जो लाइफ में हमारी खुशियाँ दी हैं, बहुत पेरेंट्स के लिए इससे ज़्यादा और क्या हो सकता है कि उसका बच्चा इतनी जल्दी और इतना अच्छा इम्प्रूवमेंट हो जाए, एक पेरेंट्स के लिए बहुत बड़ी बात है। थैंक यू सर, थैंक यू वेरी मच हमारी लाइफ में इतनी बड़ी खुशियाँ देने के लिए। थैंक यू एंडी निरोगम।
Autism is a temporary phase in the life of a child if treated timely.
Patient name, Vivan, age 4.5 years old, disease, autism. Chief complaints, speech delay, less understanding ability, inexpressive, sensory issues, lack of focus. The parents of the child consulted Dr. Navdeep Sharma on 27th November 2022 at 11:00 a.m. and felt the scope of treatment to work for the child. The chief complaints were speech delay, unable to write and sensory issues. The child could not write by himself. He was also not very socially active. Throughout the treatment, significant improvement was seen in the child. He started writing on his own, gave answers and also became active. He started interacting more and gave answers instantly. His focus also saw an improvement. He also participated voluntarily in activities and also excelled academically. Instant responses were also seen within a few months of treatment. With improved attention span, he became quick in recognizing and mind games as well. He was able to interact more with peers, participate in class and also understand things in a better way.
हाय, मेरा नाम प्रिया है एंड मेरा बेटा है 5 साल का होने वाला है एंड मुझे नवदीप सर से मेडिसिन लेते हुए मोर देन 1 ईयर हो गया है एंड आई हैव चेंज लाइक आई हैव सीन इमेंस चेंज इन माय सन। लाइक जब हम यहाँ पे आए थे तो ही वाज लाइक वो एक वर्ड ही बोलता था एंड जब से हमने मेडिसिन शुरू की है एंड मेडिसिन के साथ साथ शिरोधारा भी इसकी मोर देन 1 ईयर से चल रही है एंड विद कंटिन्यूटी ऑफ दिस मेडिसिन एंड ऑल उसमें ड्रास्टिक चेंज है। जैसे अभी वो सब कुछ अपनी चीज़ें 99% अपनी चीज़ें वो बता पाता है ईजिली एंड दैट टू वे स्टार्टेड मेकिंग फुल सेंटेंसेज ऑल्सो। क्लास में भी अकेडमिकली ही इज़ गोइंग सुपरबली ऑसम। ही हैज स्कोर्ड 88% इन हिज लास्ट टर्म एंड जहाँ पे जब वो नर्सरी में था ही जस्ट स्कोर्ड 55%, नॉट इवन 50%। एंड अभी जस्ट टर्म ए में ही इज़ इन जूनियर केजी, अभी टर्म ए में उसके 88% नंबर आए हैं। नाउ ही हैज स्टार्टेड राइटिंग ऑल्सो। पहले वो मतलब पकड़ के लिखता था, पेंसिल पकड़ के, उसका ग्रिप भी प्रॉपर नहीं था बट अब वो लिखने भी लग गया है। प्लस मुझे जो मेडिसिन से जो मुझे मेन फ़र्क दिखा है दैट इज़ सेंस, जो मुझे चाहिए था कि सेंस में थोड़ी सी डेवलपमेंट। पहले उसको फ़र्क ही नहीं पड़ता था कि कोई घर में आ रहा है जा रहा है, वो जस्ट कमांड वाइज ही चल रहा था। लाइक ही स्टार्टेड फॉलोइंग माई कमांड्स, लेकिन अपने दिमाग से वो कुछ नहीं कर रहा था। बट जब से मेडिसिन लेना शुरू किया आफ्टर 3 मंथ्स मुझे ज़्यादा चेंजेस दिखे हैं। 3 मंथ्स में धीरे धीरे चेंज आए। अब विद इन अ ईयर तो ड्रास्टिक चेंज है। जैसे उसको देख के आप बोल ही नहीं सकते हो कि दैट ही हैड माइल्ड ऑटिज्म, तो उसको माइल्ड ऑटिज्म ही था बट अब वो माइल्ड ऑटिज्म के स्पेक्ट्रम से भी निकल गया। अब जस्ट उसके थोड़े सिम्टम्स रह गए हैं एंड and we are still in touch with Navdeep sir. We are still taking the medicines. उनकी जो भी guidelines है, be it diet, be it उनका यंत्र, we are doing that religiously, and I mean it. With that हम उनको healing music भी सिखाते हैं, जिससे बच्चा internally भी heal होता है. Medicines हम दे रहे हैं. So I am quite happy with the medicines and facilities. The doctors are every time available. और मुझे हफ्ते में 1 साल से ज़्यादा हो गया, मुझे हफ्ते में 1 कॉल ज़रूर आता है यहाँ से, that you know whether the things are going right. विवान के बारे में they ask कि वो कैसा चल रहा है. तो like they are in touch. The whole team is in touch with me more than 1 year. Medicines यहाँ पे टाइम से आ रही है, हमें घर पे डिलीवरी मिल जाती है. जब हमें आना होता है नवदीप सर के, हमें कॉल्स आ जाते हैं that you know वो अवेलेबल है if you want to wait. तो the as a crux, I am satisfied with the medicines also and with the staff also. Thank you.
Autism is a temporary phase in the life of a child if treated timely.
Patient name Bhanu Pratap, age 6.7 years old, disease autism. Chief complaints: hyperactivity, speech delay, communication, short sitting, problem with understanding. The parents of the child consulted Dr. Navdeep Sharma on 2nd November 2022 at 11 o'clock am and felt the scope of treatment to work for the child. The chief complaints of the parents of the child were hyperactivity, speech delay and short periods of sitting. The child also did not communicate much. Within a year of treatment from ND Care, a significant improvement was witnessed in the child. His condition showed positive results with reduced hyperactivity, improved speech, better understanding and longer sitting. He even communicated and expressed his feelings in detail. Participation amongst peers has also increased. The child also participated actively in his school activities and showcased confidence.
बच्चे का ट्रीटमेंट पूरा चल रहा है, तो हमारे बच्चे की बहुत अच्छी इम्प्रूवमेंट है. पहले तो हमारा बच्चा बात भी नहीं करता था, कोई समझता नहीं था. अब इसमें स्पीच भी आई है, अंडरस्टैंडिंग आई है जी. अभी मतलब बैठ जाता है, पहले 10 मिनट भी बैठता था. तो काफ़ी इम्प्रूवमेंट हुई है बच्चे में, पहले कुछ भी नहीं था. तो सारी हमारी भगवान है. मतलब पहले हमें पता भी नहीं था, सरकार को पता होता तो हम पहले से ट्रीटमेंट स्टार्ट कर देते. तो हम खुश हैं अपने बच्चे के लिए.
Autism is a temporary phase in the life of a child if treated timely.
Patient name Ritika, age 20 years old, disease autism. Chief complaints: hyperactivity, behavioral issues, shouting and screaming, irritation. The parents of the child consulted Dr. Navdeep Sharma on 23rd January 2023 at 3 o'clock pm and felt the scope of treatment to work for the child. Before the treatment, the chief complaints were regarding hyperactivity, shouting and behavioral issues. She screamed abruptly and showed irritative behavior frequently. With the ongoing treatment, significant improvement was there in her condition. Hyperactivity was reduced a lot. She also became more calm and also stopped shouting. Along with that, irritative behavior also showed improvement. She also got involved in co-curricular activities like sketching and painting, which improved her performance. She also showed a lot of growth in terms of expressing herself. She started singing and other activities.
हम रणजीत सेन हैं. माई डॉटर का नेम है रितिका सेन. शी इज़ एन ऑटिस्टिक पेशेंट. 1 साल पहले गूगल में डॉक्टर नवदीप शर्मा को देखा, उनका साइट देखा, तो उसके बाद हमने कांटेक्ट किया है और 2023 जनवरी से हम मेडिसिन ले रहा है अंडर सुपरविजन डॉक्टर नवदीप शर्मा. 9 महीने में हमको बहुत ही असर मिला वो मेडिसिन से. पहले शुरू में मेरा बच्चा चीखते थे, हर टाइम अचानक चीखते थे, हर टाइम चिड़चिड़ापन रहते थे, हाइपर था, बहुत ही हाइपर था. मेडिसिन लेने के बाद उसका ये चिड़चिड़ापन, एग्रेशन बहुत ही कम गया है. मेडिसिन के साथ साथ पंचकर्मा भी दिया है और साथ में साइकोथेरापी भी चल रहे थे. तो ये साइकोथेरापी, पंचकर्मा और मेडिसिन लाके कुल मिला के मेरा बच्चा अभी बहुत ही बेटर है, पहले से बहुत ही बेटर है. आयुर्वेदिक में हमको लगता है डॉक्टर नवदीप शर्मा स्पेशली फॉर ऑटिज्म के लिए बहुत ही अच्छा डॉक्टर है. थैंक यू.
Autism is a temporary phase in the life of a child if treated timely.
Patient name Hirav Raj Singh Tomar, age 4.5 years old, disease autism. Chief complaints: speech delay, hyperactivity, poor eye contact, less social interaction, low attention span. The parents of the child consulted Dr. Navdeep Sharma on 10th August 2023 at 10 o'clock am and felt the scope of treatment to work for the child. The child was diagnosed with autism spectrum disorder, which caused the issues of hyperactivity, social interaction and speech delay for the child. With the onset of treatment, the results started showing up. There was an improvement in hyperactivity and increased social interaction.
मेरे बेटे का नाम हीरवराज सिंह तोमर है। हम लोग भोपाल से आए हैं। मेरा बेटा जब 3.5 साल का था तब उसको डायग्नोस हुआ था ऑटिज्म। फिर मैं रेगुलर रिसर्च करती रहती थी गूगल में। फिर मैंने एक बार यहाँ रिस्ट पुस्ट का और एंटी केयर के बारे में सर्च किया, तो यहाँ पे पूरे कॉन्फिडेंटली सर ने बोला है कि ये सिर्फ एक टेम्परेरी स्टेज होती है लाइफ में बच्चों की। तो वहाँ से मुझे लगा एक बार मुझे देखना चाहिए। फिर मैंने ऑनलाइन सेशंस लिए, थोड़ी हाइपर एक्टिविटी कम हुई, थोड़ी सी स्पीच भी डेवलप हुई। फिर उसके बाद हम लोगों ने फिजिकली ये जो चंडीगढ़ सेशन यहाँ पे जो इन लोगों का सेंटर है यहाँ हम लोग आए, वहाँ हम लोगों ने पूरा जो इनका पंचकर्म और सारे जो सेशंस होते हैं योगा EVA क्लासेस सारी। तो अभी हमारा आज 4th डे है। 4th डे में मुझे काफ़ी अपना बच्चा रिलैक्स लग रहा है। उसमें काफ़ी अच्छे चेंजेस मुझे देखने को मिल रहे हैं। स्पीच भी जनरेट होना और अच्छे से स्टार्ट हो रही है, सेंटेंस भी उसे बुलवा रहे हैं तो बोल रहे हैं। और यहाँ के जो सारे स्टाफ मेम्बर्स हैं वो काफ़ी सपोर्टिव हैं, बहुत अच्छे से सारी सेशंस और क्लासेस जो भी होती हैं सारी चीज़ें बहुत हेल्प कराते हैं। यहाँ का स्टे भी बहुत अच्छा है, तो मुझे यहाँ ओवरऑल सारी चीज़ें अच्छी लगी। मेरे बच्चे को भी काफ़ी मदद मिली इन चीज़ों से, काफ़ी इम्प्रूवमेंट देखने को मिल रहा है मुझे।